welcome in another episode of how you can take good care of your health and especially your dental hygiene. Today I'm going to talk about a very important subject that a lot of people suffer from, and they just keep on ignoring the symptoms and what do they have without knowing the real causes and the real treatment that can relieve the pain. The thing that I'm going to talk about today is your mouth sores. Whenever you have a mouth sores is an indication of something, and we need to source it out to know what's going on. A mouth sores is just an irritable or unpleasant sensation that you can feel in the lining of your mouth, on the lining of your gum, or in the lining of your cheeks, or sometimes even outside is just in the lips or around the cheeks area. So we need to know what are the types of sores, how can I diagnose them, how can I avoid having them in problem, how can I treat them. The first type of sores that I am going to talk about is the most common one that people always suffer from, which is the cold sore, or it's called herpes simplex. This happens to you. It's most likely associated with the flu-like symptoms when you have a viral infection. Flu is a viral infection. It's not bacterial infection, guys, please. There's a difference between viral infection and bacterial infection. I'm gonna talk about this maybe soon in the future. I'm gonna talk about this in more details. But now let's say you woke up, you were sneezing, headache, then you start to feel itching in the side of your mouth, your skin starts to break and you don't know what's going on. After 1 or 2 days, you are going to develop a sore in here. This is called cold sore, or we call it herpes simplex. This is viral, so we need to get a medication that can stop this from developing, and it's unpleasant. So there's a cream that I want you to use, which is like really good. It's an ointment or a cream. It's really good in treating the cold sores, and it's going to subside without 2 or 3 days. You don't want to have this unpleasant look on your face whenever you go outside, especially if you're a beautiful lady. We don't want you to feel unsecure about yourself. So the medication that I'm writing it on the board, so please get a paper and write it down. It's really helpful. This medication is called acyclovir, or some people they call it Zovirax, which is the trading name. I give you the scientific and the trade name for the medication. This really helps a lot in treating the cold sores. So we're done with the cold sore. I'm gonna talk about another type of sore that you might get, which is called the canker sore. The canker sore is not outside, it's not on the lips, it's inside on the lying gum. I have a picture for it. Just look at the picture. This is the canker sore. Why it happens, we don't really know. But most likely, if you are just so stressed, if you're thinking too much, if you've been having not really healthy these days, you're not eating your vitamins, you're not eating most likely the fresh vegetables and fruit, the leafy ones, they're so good. So we need to boost your immunity if you're not really taking good care of your health and you have deficiencies. So you might develop a canker sore. But it doesn't mean whenever you have a deficiency you're going to develop the canker sore. Maybe you develop the canker sore or not. But if you are most likely, it's for young age group, for teenagers, women, hormonal changes, it can develop the canker sore. So it's unpleasant sensation, and we don't want you to suffer. It's red or sometimes white or yellowish sore in the gum line. So how can I treat it? There are some ointments you can use. It just ease the pain, or any painkiller like paracetamol, Panadol, Brufen, any painkiller that you have at home. But of course you cannot take it without physician supervision. It has to be prescribed by a doctor. If you don't want to go with the medical ways, which is I prefer you go with home remedies. Now I am going to teach you what are the best home remedies that you might have to avoid the canker sores, or just to reduce the unpleasant sensation. Canker sores happens when there's a break in the gum. That happens when you have acidity imbalance, because normally we have bacteria in our mouth. Our mouth is exposed to the air, so imagine how much bacteria and germs can get inside your mouth. So once you have immune deficiency, the bacteria, they're gonna find like their best place to live, so they start to damage your gums or the lining of your mouth. So if you wash your mouth, you gargle with water and salt. You get 1 tablespoon of salt with warm water. Gargle for 30 seconds and spit it out. You make sure that you kill the bacteria in your mouth, so they are not going to have serious or more complicated. You are, just the healing process is getting a little bit faster. Okay, so the first thing you can do is you use mouthwash with salt and water. The second thing you can do is use some supplements that really good. It's so healthy, it's so important, which is called zinc. Zinc is an element. It exists in in a lot of fruits and a lot of vegetables. For example, it's a broccoli, for example. If you're not really a broccoli lover or you're not eating leafy vegetables, the zinc deficiency might develop these sores. So if you're not eating this kind of food, get the supplement. They are good for your skin, for your hair, for your nails as well. It's not just for your gums. It's good. Zinc is good. You need to get it in your and of course, something if you don't want to get the zinc, if you want to get something like from home, try to get baking soda, which is everybody has, mix it with water, warm water, and rinse your mouth with it, gargle with it, then spit it out. It helps a lot. Why? Baking soda has good effect on balancing, let's say, the acidity in your mouth. When you have a break in your gums, it means there is acidity that's caused by the oral flora. What is the oral flora? It's a kind of bacteria that normally live in your mouth. These bacteria, they might go in imbalance and they start to damage your gum. So when I get the baking soda, it's just neutralize the acidity in your mouth, so you're not going to have any problems in future, and it just subside the symptoms. Another thing you can do to release the pain of the sores, you can get basils. Basil is very healthy and it's really high nutritional, so always try to get basils in your diet. Whether you put it on your pizza, you just chew it, just get it in between your teeth and chew it. Let this oil inside it just on your gum lines, on your mouth. It's so good for your oral health and for your oral health. You know what I'm saying? So another thing you can do, clove oil, which is, it's like you can find in the spice places. They can get it. It's just oil, highly concentrated. You place it on the sore. It has really high, it's really effective in treating the sores. So the other type of sores that I'm gonna talk about, this for the immunodepressant people, like for example, very old people or babies. They don't have, they didn't develop their immunity yet, so they might develop this kind of sores. This is called gingivostomatitis sores. How do they look like? There's a picture. You can take a look at the picture. That's for infants. It's when there is a red sore on the outside of the mouth. Here, there's a red sore. And in the inside, there are sores, but they're like white, yellow, grayish in color. You will feel your baby is irritable and they cannot breastfeeding or they cannot feed. Maybe they develop fever a little bit. It's annoying for the baby, but you have to be patient because this is common. It's like really common. Try to breastfeed your baby as much as you can so they can develop their immunity, because the breast milk is full of the essential and the most important immunity that your baby needs. So just don't ignore that. Another type of sores that I am going to talk about is the sores that can develop due to irritation. If you're wearing braces, if you're any trauma that can happen inside your mouth, if you're getting a filling in a dentist or in a dental clinic, and then by mistake or anything happens that you might hurt your gum line, so you might develop a trauma and there's gonna be a sore. Unpleasant sensation as well. It's annoying. You cannot talk. Maybe you cannot swallow, you cannot be normal. So in this case, just wait, try to go back to the dentist and try to avoid any cause for the trauma. You should know what causes the trauma and avoid it. When you have a problem in your gum, you should go and buy a new toothbrush that has soft bristles, and you gently, really gently and slowly brush your teeth so you don't cause any more damage to your broken gum lines. That was about the sores that can happen due to trauma. It just comes in the name, under the name of canker sore, kind of. Another type of sores that can happen in your mouth, they are called the mouth thrush or the candida. The candida is a fungal infection. You can take a look at it. There's a picture of the candida. So fungi are microscopic organisms that can invade your body. Normally they live and they don't cause any problems, but if you're stressed, if you have any immunodepressant reasons, low of like anemia, you have most likely like unhealthy diet, deficiencies of certain food and minerals, vitamins, the fungi can get the benefit of this and they're gonna invade your body. As well, it happens to the people with HIV positive, the people who have AIDS. What happens in this case? There will be a very big white patches on the tongue, on the lining of your cheeks, the roof of your mouth. And it's so annoying, so unpleasant sensation, and it's just like it stays for not short time, but you really have to be careful not to get it. How can we avoid not getting it? By being healthy. There are some antifungal creams that you can take. There is antifungal drugs and medication that you can use, and you just stop having these. By the way, I have it myself. I was like last year, I was so stressed at work, so I couldn't talk for a week. So it just so unpleasant sensation. So I really wish no one has it, because I tried it myself and it was so unpleasant sensation. But it's good somehow because I lost weight. I couldn't eat by then. Yeah. So that's the candida. That's all the kind of sores. There are so many kind of sores, but they're so not common. But just a summary, any sores that last for more than a week, you need to investigate. You should see a doctor, because it maybe can develop to a cancer, and we don't want this to happen. Don't ignore what your body tells you. If your body tells you like it shows something, it means there's something abnormal. So you have to wake up and you have to investigate if there is a hidden reasons for the sores that you might have in your mouth. So in general now, the types of sores, most likely if you want to get home remedies for them, baking soda is amazing, water and salt is amazing, clove oil is amazing. Something else that I forgot to tell you about, which is the yogurt, the probiotic ones. That this yogurt, once you use it, it's good for your whole digestion because it replaces the damaged oral flora. If your oral flora, which is, I already talked about it, which is a type of bacteria that can be, let's say they became aggressive. Well, we're friends, we used to be friends with them, but suddenly because of my immunity or because of deficiencies, they will start to attack my body. So I want to replace the oral flora that I have, so the yogurt is full of this good bacteria. So not all the bacteria are bad, some bacteria are really good and we need them. So it's gonna replace the oral flora, and it's when you put it in your mouth, you have a sore mouth, it's just going to soothe the pain, and you're not going to have that pleasant for a while, I know, but it's better than nothing, you know, until your body can be strong back again and you can find the diseases or any reason for the sores that you might have. So I wish I was beneficial and you could learn today from types of sores, how can we avoid them, and how can we treat them with really easy and home remedies that we have, everybody has in their homes. Thanks for watching, and I'm looking forward to see you in more and more of episodes. Be safe.